Hello everyone, this is Carrie Dillinger. I will be doing my topic on early school age children with autism spectrum disorder, and the issue will be school attendance. This is a brief overview of my presentation. I will first describe the psychosocial crisis to see how that will apply to autism and their challenges. And then I will go into defining autism, citing symptoms, statistics, implications of counseling, some treatment interventions as they apply to the school setting, and some parental tips at the end. At preschool, children encounter a widening social world. They are challenged more and need to develop more purposeful behavior to cope with these challenges. Children are asked to assume responsibility, and therefore uncomfortable feelings of guilt may arise if the child is made to feel irresponsible or feeling too anxious. Around ages 3 to 5, children assert themselves more frequently. They have already acquired the self-control and confidence, and they are ready to perform actions and observe their consequences. And they learn from about their effect upon other people through these interactions. A child can develop guilt when the opportunity to take initiative is squelched through criticism or control. The child may feel like a nuisance. Too much guilt can slow the child's interaction and inhibit their creativity. Guilt is more internally driven than shame and doubt. The identification central process, the children incorporate their parents' values into their own behavior so they can develop a sense of independence since they feel like their parents are with them. And the adults can direct their child's urges towards acceptable social practices, which provides the purpose, behavior with direction. And inhibition is restraint or suppression of behavior, which is blocking behavior based on unacceptable practices. Overall, success in this stage leads to purpose, and failure would lead to inhibition. These are the tasks for early school age. Children with autism are going to struggle with all of these tasks, especially since they have not quite mastered the tasks in toddlerhood, like self-control, fantasy play, and language. Most specifically, they will struggle with peer play and self-theory. A symptom is called absence of self-theory, which is mind blindness, and that's where they're unable to grasp false beliefs. Autism spectrum disorder, also known as autism, is one of the most complex neurodevelopmental disorder. It is mainly characterized by repetitive patterns of behavior and difficulties with communication and social interactions. Children of autism are likely to experience several symptoms, as you can see that's listed on this page. These are some diagnostic features of autism spectrum disorder. Impaired social interactions, there's impairment in nonverbal behaviors like facial expressions, postures, gestures, eye contact, that normally regulate a social interaction, does not develop age-appropriate peer relationships, failure to express pleasure and happiness of people, and does not show that social or emotional reciprocity, which is that give and take. For impaired communication, there is delay in development of spoken language, which is not compensated through gestures. When speech development is adequate, there is nevertheless lack of ability to initiate or sustain conversation. There is abnormalities in the form or content of speech, maybe stereotypes, repetitive speech, sarcastic use of words, speaking about the self in third person or second person, does not show spontaneous, social, or imaginative make-believe play. For restricted and repetitive behavior patterns, they show restriction in range of interest, insist on routines, taking the same route from one place to another, show stereotype movements like hand flipping, head banging, rocking, spinning, and shows preoccupation with parts of objects or unusual attachments to objects like carrying a piece of string. And the onset of these occur prior to age 3 through the display of abnormal functioning and at least social behavior, communication, or imaginative play. Here is a general list of some challenges and some strengths. I wanted to include the strengths because it's not always important to emphasize the knowledge of challenges. You need to be able to uplift and empower their strengths too. A few challenges they may have is grasping the picture, experience not being able to be motivated into another area that they're not interested in, sensory integration problems with their background noise, and they're not going to be able to perceive unwritten rules of social interactions, which can be learned through direct instruction and social narratives. And it is very important to recognize that for every strength and challenge that you will see, you will often encounter people that will prove the exact opposite in these examples. CDC, about 1 in 68 children will be diagnosed with autism spectrum disorder. It is reported to occur the same across all races, ethnicities, and social economic statuses. It's more common in boys than it is girls, about 4.5 times. The diagnosis of autism can be determined as early as age 2, which can be a reliable and valid diagnosis according to research, but most children are not diagnosed until age 4. The symptoms emerge early, around 18 to 24 months, and the autism is incurable and does not have a specific cause. And about 1 in 6 children in the United States has a developmental disability, and this includes autism spectrum disorder in this population. I'm going to start out with the risk factors. As you can see, autism is inherited. Parents with children can have a second child, and there's studies with identical twins and non-identical twins. Children born to older parents are at higher risk. I would like to highlight this because I will be using it, incorporating it with my issue. Almost half of these children have above average or average intelligence. Premature birth or low birth weight is a risk. Autism occurs more often in people with genetic or chromosomal conditions like Down syndrome or Fragile X, and also, co-occurs with other developmental disabilities and psychiatric, neurological, but the most common is developmental diagnosis, 83%. As you can see, the economic cost is outrageous, $11.5 billion to $60 billion a year for a child. The behavioral interventions is $40,000 to $60,000 per year, and the Medicaid difference is 6 times higher the cost. So it puts a real strain on parents. Here's a little something about the role. A counselor can know the symptoms of autism and educate others around it and debunk the myths or misconceptions that they may have about it, and also identify the needs and wants and individual strengths of those individuals, and be familiar with the common struggles of the child and those struggles of their parents and siblings. And they can offer a strengths-based approach for serving the child and their family. For a school counselor, they could provide characteristics of the child with special needs, educational assessment, and preparing for individualized education programs or plans, IEPs, deciding on which behavioral modification plan to method, strategy to use, and providing knowledge and support to preschool teachers about inclusive practices so students can be successful. These interventions are directed at challenging behavior. I included steps for each intervention of how to complete it. For self-management, which is improves behavior and helps with completing schoolwork, it will be distinguishing desirable and undesirable behaviors and gradually, systematically increasing the time of the response to the increment. You will provide a reinforcement, and this is how they will learn to manage. Functional communication training has been the most successful intervention for teaching communication with replacing challenging behavior. And this, it is important to remember when teaching functional equivalent replacement behavior that it needs to be practiced frequently until the child is able to use it efficiently and readily without engaging in the problem behaviors. These interventions are directed at communication. They're derived from the applied behavioral analysis. They're designed to increase motivation by following the child's lead. There are significant improvements in verbal communication, in addition to decrease in challenging behavior, increases in positive affect, and higher levels of joy and attention. The most efficient way for communication to improve is provide more opportunities and motivate the child to communicate. These interventions can be used in the school setting with the picture exchange for using the picture as the communication tool, and the pivotal response using the modeling of a word or request and expecting that child to return that request over time. Overall, these are very effective interventions for children with autism. Here's just a short success story about the PECS picture exchange communication system and an example of what it would look like. These interventions are for social interactions, self-management, as I discussed in the earlier slide, initiation training. This is used for taking ownership and leadership, initiating social behaviors like requesting turns, asking questions, social scripting, or script dating, using written or pictorial scripts with cues of social behaviors. And as they improve, these scripts will fade. Peer-mediated procedures, which is developed activities based on interests, and peers model social skills, such as taking turns. Here are the guidelines for the previous interventions. There is no roadmap to matching students' characteristics with specific interventions. Interventions need to be implemented into inclusive school settings, least restrictive environments, or general classrooms. Schools and families need to work together. Self-management is helpful at maintaining skills. There will be many team members working together to support the student. Programs should be individualized based on comprehensive assessments. There should be opportunities for communication throughout the day. Identifying and targeting pivotal areas help improve efficiency, and interventions that target specific symptoms are better than with a narrow focus, and there's no single effective method. Education is going to be one of the most important activities for the counselor regarding symptoms, issues, struggles, strengths, and preferences. A helpful rule of thumb is to provide as much education as can be ingested at the pace, depth, appropriate to the developmental level and interest of the receiver. Social skills training based on a lot of logical, sequential, if-then, social, and communication rules. This is for the less severe dysfunction. Social skills training may can be conducted in a group format with age-appropriate group members applying appropriate social rules. One-on-one counseling between a higher child functioning with autism and a counselor can be beneficial, especially for children with anxiety and obsessive interests. Training in applied behavioral analysis can assist a counselor effectively working with children with autism. There's no particular medication effective for reducing or eliminating the symptoms of autism. However, there are a lot of medications that are used to reduce irritability, hyperactive, depressive symptoms, as well as repetitive symptoms. The counselor can be a vital link by providing compliance with the medical profession's prescribed regimen. Occupational or physical therapies can be helpful, especially for children with sensory integration or core motor skills and coordination. An assessment of the child's environment needs to take place to assess the levels of stimuli. Supportive interventions, one of the most effective roles a counselor plays is assisting the family to create and maintain a routine and structure that helps all the family members and keeps an unnecessary stimulation down. Overall, therapy can improve language and social interaction, and medication can help control the repetitive behaviors. These are some strategies for some social skills that would be important, like reinforcing what the student does well socially, modeling social interaction, teaching imitation, teaching context clues, using visuals, celebrating strengths, providing peers with strategies for linking communication, supporting peers and students with structured social situations, educating peers, teaching empathy and reciprocity, using social narrative, developing listening and attentive skills, and teaching social boundaries, which you can use your social narrative as a tool. And another one that you could do is identify peers who model strong social skills and pair them with a student who has autism. Here is a success story that relates to social skills training. In the upper picture is an actual autistic boy. He's a high school basketball wonder. He made 6 three-pointers and 1 two-point shot in the last 4 minutes of the game. He went from the sidelines to playing in the game. If you want to go to YouTube or Google, you could research him, and it's a very inspirational video of the last few minutes of the game. And it goes to show you that with support, that they're able to go on in society and be highly functioning and successful. Earlier, I was talking about the statistic of having older parents as a risk. So this is the middle-aged parents. There needs to be support because it is linked to further development in the cognitive and emotional and physical domains. These parents are normally in the process of learning how to balance work and family life, so they're going to be struggling with the economic pressures and plus the pressure that's from their child with autism, and then their other children, and how to balance all this out. Also, with the behavioral interventions, if a child receives early intervention, they are more likely to improve in language development, and most of the time by 5 they have developed language. In closing, be the best parent that you can be so that your child can become the best person he can become, or he or she can become. Remember, your child has a disorder that not only makes him different, it also makes him unique. In our efforts to make our children conform to our ideals, we risk taking away their uniqueness and individuality. Focus on your child's relative strengths, not just his weaknesses or hers. Love, laugh, embrace, persevere, and be confident that your child will continue to learn with hope. These are some interventions that came from a parent's perspective. Think visual. Your child can learn the most through visual tools. They need that security. Take your time. They will need that time to adjust from one activity to the next. Set goals. Get involved in sports. Purchase cool toys. Siblings can help be wonderful models. Inform and educate others. Friends, go for success, but always consider the environment. Be creative and love, kindness, and respect, and demand that others treat your child with this too. I would like to include a last thought. When autism is diagnosed early and they grow up in supportive and responsive environments, they lead satisfying lives. Thank you for listening.